Hi, I'm Dr. Rajani. Thanks for joining me for Raji's Quick Clip. I'm talking about PDO threads today, and we're talking about burying that thread to avoid a side effect. 3 seconds. So if you like the videos, click like, subscribe, and hit the bell because we have videos coming weekly, sometimes several times a week, to keep your skin beautiful, healthy, and vibrant. So today's quick tip on PDO threads is all about burying that thread. I always get my topics from you, people out there who have gotten threads and who had side effects, trainees who've come to us before, and you see trends. It's kind of a funny thing. Well, the trend over the last couple weeks was people putting in PDO threads and seeing where the thread was inserted. Now, you can see it for one of many reasons, but one of the most common is when you clip the thread, when you clip the edge of the thread. If you don't bury it, so you're lifting it up with the forceps, pushing down with the scissors, and clipping it, but not the skin, only the thread. If you don't bury that thread and then move the skin over the thread rather abruptly, meaning with some force, where you're moving that thread and engaging it, but at the same time burying the cut end, well, it will work its way superficial and you'll see a little, you can see like a cyst, you can see a protrusion, sometimes it's deeper, but superficial enough to give that irregularity. Sometimes only with dynamics, smiling, or sometimes in the neck with moving. If they move a certain way, the thread kind of brings the skin together and accordions it. Why? Why are we seeing it now when people trained a while ago and haven't had a problem? It's because the threads we use now are often a little bit bigger, so 18 gauge in the face. They used to be mainly for the body. 21 gauge was a pretty big thread for the face. Now, or for the body, now we're using it in the face. Why? People want lift. They want to try and get a facelift with threads. And you know, if you listen to this channel, we use threads as combinations with plasma sculpt, with sculptra, with fillers, neuromodulator to get the best result. But the trend has been to moving many big threads. And yes, you can get amazing results. But as you go to more aggressive treatments, you're getting more downtime. Sure, you'll get more effect. You'll have more risk of hematoma, bruising, feeling the threads because they're larger, they're stronger, and there's more of them. So bury that thread. It's a complication you don't want because what happens, it's sitting there, it's red, might be a little bit inflamed if it's superficial, and you're wondering, is it infection? Is it the thread? Did it become engaged? Did the thread crack? If you're using old threads, we'll do a whole video on that, the thread could crack. So you can watch my complete playlist on here of PDO threads. And remember, subscribe if you like the videos, click the bell, because if you click the bell, you'll be reminded that the video's up and ready. We do a few a week. Thanks for joining me. Raji's Quick Tip.